Hi, Glam Tutzak here. So I'm making this video. This is part one of different questions about different topics that you guys frequently ask me, and hopefully your questions on this list and I can answer it for you. The American Dental Association recommends that each child come in by the age of 7 so that we can do like an evaluation and a pre-screening to see if there's any issues with the teeth of the skull. So usually children start braces at about age maybe 10 to 12, but it depends on the development of the permanent teeth which come in. Typically, the average treatment length time is about 2 years, which is 24 months, and that's usually what we tell patients. But of course, there are some severe and complex cases, such as those that have like craniofacial things going on, deformities, or the patient may need surgery. So those treatment times can actually go up, and those treatment lengths can be anywhere from 3 years to 5 years or more, sometimes, depending. And the answer to that is absolutely not. The only thing is that we require medical and dental clearances from the dentist and the medical doctor that you have so that we can just know that you're healthy for treatment and that you're clear to start treatment with us. So that's the only limitation that I could think of. You can treat your teeth at any age as long as you're healthy. And you will be sore. Anytime we're moving teeth, it's going to be a process. Whether you're doing braces or Invisalign, the teeth are moving, they're going to be a little sore. I wouldn't say it's like a sharp pain that you would feel, but it would be more of a soreness of the teeth moving. It's perfectly normal. It's healthy. I mean, we have to move the teeth. That's why we're here. And then secondly, it would be more of like a pressure and not so much of a sharp pain, but definitely a little soreness. So braces actually align the teeth by pulling them along the wire. The wire is pre-shaped for a certain perfect arch form. We glue the brackets onto the teeth, which is like a handle onto the tooth, and those handles grab onto the wire and straighten out with the wire. So the braces kind of pull the teeth into alignment versus Invisalign pushes the teeth into alignment. We glue these little pressure points onto the teeth. They're very aesthetic. And then the trays push the teeth to where they need to go to be perfectly aligned. That actually depends on the case. So there's some cases which are more severe, which will be more predictable with braces. If someone requests Invisalign, I usually like to honor the request. However, some cases are not as predictable or may not have the best results with Invisalign. So it just depends on the case and the person. So that also depends. In braces, we usually see our patients from 4 weeks to 6 weeks. So that's about a month to every month and a half. But with Invisalign, we can see our patients every 2 months to 3 months. So the reason is with braces, you come in, we tighten things up. But with aligners and with compliant patients, usually, we'll give a batch of aligners that patients switch out weekly. And then we can see them every 2 months to 3 months. So every 8 weeks to 12 weeks. So just a slight difference there. All right, so that was part one of this series. Stay tuned for the upcoming parts, which will talk about different things like costs, maintenance, and care, and appearance, and different things like that. See you soon.